All right, welcome everyone. It's a couple of minutes after the hour, so we'll start. This is the inaugural event of our 2022 Tech Tuesdays. And this year, we will be featuring speakers and startups from around the country who are working to address the unmet market needs through innovation and entrepreneurship. Throughout the year, Uncovering Markets, we plan to feature a series of startup founders who are developing companies in a wide variety of tech areas, from Latinx health to femtech to Bitcoin. And so in this program, featured speakers are going to talk about how they came up with their ideas, how they built their product, what the market opportunities are. And so what we want to do is introduce you to entrepreneurs and innovators who have approached the market with a unique perspective, or have explored how to develop a product in an unmet or underserved market. The host for this series is going to be Erik Pavia, who is founder of his own startup, Pantheon, and an entrepreneur in residence at the MCA Innovation Center. And I'm going to turn it over to Erik and let him introduce himself and introduce our featured speaker, Erik Cardenas. Also, if you have questions, please put them in the chat box and we'll get to them as we go along. Thank you so much.
Thank you, Nancy. Hi, everyone. My name is Erik Pavia. As Nancy mentioned, I'm the entrepreneur in residence at the Medical Center of Americas at the MCA, and I'm the founder of a startup called Pantheon. And we've been working at the MCA Innovation Center to try to get more people thinking about either starting companies or taking the leap and developing products. And we serve an interesting community, which is the El Paso Juarez region. So in the El Paso Juarez region, we have a couple of interesting demographic dynamics coming together. The first is that it's a predominantly Hispanic and Latino neighborhood. We're on the border with Mexico, and 80% of the population here is Hispanic or Latino. Another one is that we don't have a very large startup ecosystem in the region. El Paso is known for many things, but it's definitely not the startups. And so we think this presents a really exciting and interesting opportunity, which is there could be more startups developed in the region to serve the people that look like us. And so I wanted to have this discussion with Erik Cardenas. Erik has been a super helpful mentor to me over the few months that I've known him. And I think he's working on something really exciting that ties in really well with serving these types of communities, and with building products for underserved and overlooked markets. So a quick intro on Erik, and I'll let you go into more detail, Erik. But he's a healthcare leader with over 20 years of experience in the industry. Prior to starting Zocalo Health, he was on Amazon's, he was a founding member of Amazon Care and on Amazon's COVID-19 response team. He's also a board member at the Rogers Behavioral Health Institute, or is that correct, Erik? Did I get that right? And he's passionate about addressing inequalities in healthcare and bringing quality care and services to those most in need. So I thought there was a great overlap with you, Erik, what the MCA is doing, what the Innovation Center is doing. And I thought you'd be a great guest to kind of kick off this series of looking at serving these unmet and underserved markets. So just to get started, dude, can you tell us a little bit about yourself? Where were you from? What was your trajectory in life, and how did you get to building and starting Zocalo?
Yeah. And I guess before I do that, I just want to thank you, Erik and Nancy, for the invitation and for having me here today. I really appreciate this opportunity. So yeah, just to give you kind of the intro, I'll try to keep this short and sweet, because it matters, especially with what we're doing with Zocalo Health. I'll share that, I was born and raised in Houston, Texas, right? So Tejano, grew up in Houston, inner city. My parents were immigrants from Mexico. I grew up in a neighborhood. I didn't have the best access to healthcare, best access to education. a lot of the struggles that a lot of people in our community have to deal with, day in and day out. I was unlike, my other siblings who, stayed close to home. For whatever reason, I was the one that kind of strayed away and really got to work in healthcare. And so I've gotten to build a career in healthcare that spans over 20 years. I worked for some large health systems, did some really good work in the IT side of the house when I worked for these hospital systems, and then got into entrepreneurship around 2014, 2015. Started my first startup. It was a cancer navigation application. That company failed. Learned a lot of lessons in that. Definitely glad that was at the very early part of my career and not now. You learn a lot, right, in some of these failures, which is really a really important lesson for a lot of entrepreneurs. But I had the opportunity to do it a couple more times, and was pretty successful in helping build a company called Everlywell. Really cut my teeth in the direct-to-consumer diagnostics space. And then about 4 years ago, I got recruited by Amazon to come build, at the time, it was a confidential project known as Amazon Care, which was really focused on delivering a more convenient, like customer-obsessed experience for patients. While I was there, the pandemic started. I moved to Seattle. Pandemic started here in our backyard, and with that diagnostics experience that I had from building companies like Everlywell, I got to present to our senior leadership team, a COVID response, and that ended up being our broader Amazon COVID response, which was definitely a big win. It was a feather in my cap for sure. And I probably could have just hung out at Amazon and lived a pretty happy life. But I also got to see that, a lot of communities of color were impacted really bad by the pandemic. And so I decided that at that point, this was in August, that I would resign from Amazon and focus on building a company that actually started to address some of these inequities that we were seeing in healthcare, specifically among the Latino community.
So, dude, and I want to come back to a lot of these points that you just mentioned, because they're interesting points, both not just for you as a person, but also in understanding how people come up with what to work on. But before I do that, can you talk a little bit about what exactly you were building with Zocalo and like what the overall mission is?
Yeah, for sure. I could talk. So there's plenty of problems to talk about in healthcare. I mean, a lot of people oftentimes will talk about how in the U.S., like, we spend so much money on healthcare, yet we have some of the worst outcomes, and that's true. I think when you look at the Latino population specifically, this is a population that's exponentially growing, yet the health outcomes are worsening. And when you think about just the healthcare system, it becomes significantly harder to navigate. And so what we have to think about is like how to address these barriers, how to find ways to truly make it a little bit more, a little easier for our community to navigate that. And so I believe that what we have to do is we really have to focus on bringing high access care options, namely primary care, to our community. I think that if we can do that and really build a solution that makes things a little bit more convenient, a little bit more transparent around cost, and also take more of a holistic approach. It's not just about taking care of yourself when you're sick, but it's also addressing things like mental health. It's also about addressing things like social determinants. The fact that some people in our community have to make trade-offs between paying for medication or paying the light bill are things that obviously impact our health and impact how we consume healthcare. So I thought that in order for us to really make really make an impact here, that we needed to rethink how we deliver healthcare to the community, and that's ultimately what we're aiming to do with Zocalo Health, is to truly deliver a better healthcare experience that addresses a lot of the barriers that are unique to our community, and that allow us to really start to meet people where they are, with a real focus on like cultural, proficiency and all the things that just make our community unique.
So going back a little bit, you mentioned that you grew up in Houston. Your parents are immigrants, and you're like the one who left home. So I mean that kind of, I had a similar experience. What do you think motivated you to go into healthcare specifically, and what were some of the drivers that got you to be like the kid who left home?
Yeah. Well, listen, like I'll tell you, Eric, that this is part of like my story that gets a little personal, and it kind of goes for a long time. This was a part of my growth that I was actually a little bit embarrassed by. Like growing up, my parents taught us that, you know, in order to be successful, like you just need to work hard and you take care of your family. It was like graduate from high school. If you're lucky, you'll get a job at Exxon, you'll buy a truck, you'll buy a house, you know, you'll raise a family. And that's good. Like I have a lot of respect for people that choose that path. I went to school. I went to a university. I thought, you know, I did good in high school, but at the time I didn't realize just how different things are for people growing up inner city versus people who maybe grow up in more affluent neighborhoods. So walking into Texas A&M, you know, my first year, it was a shock, and I got kicked out. So I didn't get to, you know, live that story that a lot of people have, was going to a four-year university, doing the things that, you know, and taking that path. I kind of leaned on the hustle and just said, all right, well, fine. If I couldn't make it, right, I got a job working, you know, reception at a clinic. And I was just very fortunate that at the time I had the opportunity to start working in IT. And so when, you know, I was given that opportunity, I did what my parents told me, right? Is like, bust your tail, do well, let your work do the talking, and the rest will take care of itself. And the fact that I was given opportunities, and I had great leaders at certain points in my life that kind of gave me, you know, opportunities, and you know, I guess I was able to deliver and really deliver results. I think that's all I needed to really start climbing that corporate ladder. And one opportunity after the other, being able to really kind of lean in. And while for a long time I didn't have that degree, and I was worried about, like, you know, should I even be at the table? Should I even be having conversations? That was hard. And this is where a lot of that imposter syndrome comes in. And you know, fortunately, you know, fast forward a few years, I was at Amazon, you know, full-time, building a brand new company. And I actually finished my undergrad doing that. And it wasn't until I started telling people that I realized, like, well, you know, not everybody takes the same path. Everyone has to kind of pick their own path. It won't hold you back in your success. You just have to kind of make the best of it. And now I like to look at people who are maybe a little underrepresented or who are in similar situations, and try to give them opportunities to the way I was given opportunities. And so definitely didn't take the conventional path, took the path less traveled, but still feel that it was still very important in my story, and really helped me with a lot of the things that I did, both in the startup world and the corporate world.
Yeah, that's awesome, man. I mean, just a small commentary there, which is it's great that you're sharing that story and you're not like embarrassed by it, because there's a lot of people like that. I mean, I did the 4-year school thing. I went to a local school that accepts 100% of students, you know, UTEP here in El Paso. And, you know, usually you tell people like, oh, I went to UTEP, like they don't think much of it. But, you know, it's the opportunity that's available to us here in the region. And yeah, I think it's great to have those types of role models. So it's awesome that you're telling that story and making part of that story moving forward. So you mentioned you started working in IT in a clinic, and then you eventually were working at Everlywell. Just for people who aren't familiar with it, can you describe very quickly what Everlywell does?
Yeah, so this is where you know, I got to go from working in this legacy health system, which, you know, nothing had changed for a very long time, right? It was delivering care in the hospital within a clinical setting, the very same way that it had been done for decades. And then I made the jump to basically join a company called Everlywell, which was one of the early companies to start this direct-to-consumer approach to basically selling lab tests directly to consumers. So you can go online, you can buy a test, and without having to talk to a doctor. And these are low-risk tests. These are like more for health and wellness types of reasons that you'd want these tests. But basically, you get a test, you'd order it like you would on Amazon, collect your specimen at home, send it to a lab, and then you get results that were very simple to understand. This was kind of the early days to some of the trends that you're seeing in healthcare today around consumerism, which is that it's really enabling you know, the average patient to take a little bit more of a, you know, a role in their healthcare and really focus on wellness and making things a little bit more accessible when it comes to like biomarkers, like knowing, testosterone levels or your risk for diabetes or, fertility markers, things like that. So it was definitely an early company. Now it's a $2 billion company, doing very well. I clearly didn't have a lot in that success other than I helped start that company and was critical in getting the very foundational part up and running for Everlywell in that first year and a half.
And so what are, both in your experience in, across, doing IT Everlywell and then at Amazon, like what was was there like a insight that led you to say like, hey, like I'm done with this, I'm going to go start my own thing, or was it a collection of insights over that period of time?
Yeah, I think it's definitely a collection of insights, and I always knew that I wanted to do something for myself. I think for a lot of people, making a jump into entrepreneurship, everyone has their own reasons. Well, I had kind of dabbled in it and helped build companies from the ground up. I always felt that there was a lot of risk, and some people are more comfortable with risk. I'm not your typical entrepreneur. I'm 40. I have a wife and 3 kids. You tend to try to avoid risk as much as possible. But in this situation, I really felt that there were a lot of things that were really strong tailwinds for me. One, I had an exceptional co-founder in Marissa, who I met at Amazon, Latina, who had a very similar mission and mindset around wanting to serve the Latino community. So taking kind of our learnings, and then we looked at just like where the market was, and again looked at what was out there. Are there other companies doing the same thing? Are they doing a good job? Is there room for more competition? Things like that. And everything lined up. And of course, working at Amazon, having some experience with successful startups, it also makes it a little bit easier for you to have those meetings with investors, which was a big part of our ability to make the leap, right? So I resigned in August, was able to raise a few $1 million in venture capital in September, which basically allowed us to kick off Zocalo Health. And so a lot of great experience. But I think the one key takeaway here, Eric, is that this is the first time that I get to do something that isn't for someone else. It's actually for me. Like I'm building Zocalo Health because at Amazon we built this great customer focused experience where everything was convenient, but we started only for our employees, and it wasn't something that I could extend to my parents or to my tia or my tío, who I know could really benefit from these conveniences. And so I know it's a little cliche when people are like, hey, solve your own problems and build a business out of it, but it's true. Like this is actually the case for us. And so while I want to build something that not only I can use, not only can Marissa use with her family, but we are also trying to build something that we can extend to our family, to our parents, so that we can share the same conveniences that I think the market is missing right now when it comes to healthcare.
Yeah, that's awesome, man. And for people who aren't familiar with the big corporate structure, like why is this something that you couldn't just pitch to Amazon and say like, hey, Amazon, this is a great a great business line that we can follow. You have infinite money. Let me do this internally somehow. Yeah,
that's a great question. And I think this is where I learned a lot from Amazon. It was a fantastic place for me to work. And I think I'll take a lot of the things that I learned from Amazon with me into Zocalo and future endeavors. But the reality is that I think in order for us to really serve this community, we have to build a company that consists of bits and pieces that are representative of that very community. And while I think a lot of major corporations are doing a great job in trying to promote diversity, and things like that in the workforce, those are things that are going to take time. And this is why we needed to do it on our own. And we're doing that now by not just, our investors, for example. We made sure that half of our investors were representative of the community that we want to serve. Marissa and I, again, Latinos, we're building for ourselves, our workforce, our advisors. we want to build people who can really get behind this mission. And I think this is the way that you do it to really start to address the needs, right? And this is where we're building relationships today with people, as we did a lot of research back, Q4 of last year, and it involved going into our old communities, like where we grew up, and talking to people and finding out what's your story, right? And how do we take that and start turning it into, a product or a service that actually starts to meet their needs. And so while, yes, I think that there's a lot of opportunity within, large organizations to do some of this work, for us specifically, I felt that, this was a great opportunity for us to just do it with a very focused way. And I think in this situation, like we just felt like we could do it better right now ourselves, without any of the complications, the bureaucracy, things like that you tend to encounter in larger companies.
Yeah, man, that's great. I imagine, you probably can't hire for the same diversity when you're inside of a big Amazon than, when you're making those decisions
Right.
yourself.
Yeah, well, there's a lot of good intentions, right, with a lot of these initiatives. You still have to break down some of these structures that kind of got you in that situation in the first place, right?
Yeah.
And so it's hard. It's definitely hard.
I want to touch back on the point that you made about raising venture capital in a little bit, but first I'm curious about what are some of the core insights you've been able to develop around surveying the Hispanic and Latino population, and how did you gain those insights? I mean, I know you personally have this work experience, but you mentioned going out and talking to people in the community, but what are some other things that you've done to really figure out what are the core insights that are driving Zocalo Health?
Yeah. So we, like I mentioned, we talked to a lot of patients. I think that was core to some of our early research. Everyone has a story to tell, and we really felt that it was our job to listen and to really build a system to meet those needs. One thing that that resonated with us a lot in just our own experiences, the experiences of our family, and then a lot of these interviews that we did, was that healthcare right now in large part is one size fits all. And what we know is that it's not working. And while, yes, we are focused on the Latino community, we also recognize that the Latino community is not a monolith, right? We are diverse, and we deserve a health system that meets our diverse needs, right? And language may be one of those things that we need, but even then, just translating, right, things from English to Spanish without the context, without really taking into account our culture, our beliefs, those are the biggest gaps that I think exist. And really, and then also just the fact that there's a lot of mistrust, in several institutions, healthcare being one of them, finance being another. So how do we unpack that? How do we learn about what are some of the root causes for some of this mistrust that, again, we need to inform our decisions and our strategy by some of these reasons. And some of the other insights that we really kind of found that were really helpful in sort of helping us define this was also around the pandemic, right? That there was just a lot of disruption that happened with the pandemic. We looked at some of the social and economic drivers for the community. And I mean, this is happening to us. And I'll tell you, Eric, I even feel guilty about this sometimes. I could tell you within my own family, I have family members that live paycheck to paycheck. And there's situations where because of the pandemic and because of poor access to healthcare resources, if you're living paycheck to paycheck and your kid gets sent home, right, because he's sick, and you can't get a COVID test for 2 weeks, during Omicron, that wait was 6 weeks. What are you supposed to do, right? You have to skip work. And those are the kind of pain points that have a ripple effect, right, for months, and start to really impact an entire household. And so we recognize the pain points that this has created for a lot of families, how the pandemic has really made that worse. And we definitely feel like there's a real opportunity for us to do better and to start meeting the needs of that demographic. And I think the one key takeaway that I think was also very insightful in a lot of our research was the fact that we also recognize that the millennial generation, like for a long time as a millennial myself, I thought that we were young and healthy, but man, the oldest millennials are 41 this year.
Yeah.
And you know, a good percentage of us have at least one chronic condition. And I made a point earlier, right, around how my parents told me, like, you know, work hard, take care of your family. But never once did they say prioritize your health. Because if you don't, and at this point, you know, if you're pre-diabetic and you're 40, like you actually got to start paying attention to this stuff, because we'll be in a position where you can't take care of your family.
Yeah.
And so all of a sudden we are in a situation where we have an entire generation who hasn't prioritized their health, who hasn't prioritized a healthy relationship with a primary care physician. And I think that's the core opportunity for us. That was a key takeaway that told us, like, all right, here's the problem. Now we got to figure out how to solve it.
Got it. So one of the things I like about talking to you is that you're a very your thoughts are very structured, and the way you approach problems is very structured. So I have more of kind of a tactical question, which is, as you're doing these customer interviews and you're gathering these customer insights, how did you go about that? Like, what did the customer interviews look like? How many of those did you do? Were you conducting other forms of market research, such as surveys or whatever, buying industry reports? Like, how do you gather your information to figure out what market to tackle and how to tackle that market?
Yeah, so you find a co-founder who's really good at it. So that's where we start. I was very fortunate that Marissa did a lot of this stuff for us, at Amazon, and but there was a little bit of an audible that we had to call, because when you're a large corporation and money is no object, right? You have money that you can spend on limitless focus groups and things like that. You don't have that when you're at a startup, and so you do have to get scrappy. And there's no substitute for just getting out there in the community and having conversations with people. If you it's not that hard to find people who want to talk to you about things that are frustrating, things that impact them. And so I think that is by far the one thing that you have to do, is just get out there and have conversations. There's a few things that you could do to make sure you're not leading people and kind of, there's some structure. So definitely spend some time researching that. But I think, being able, we leverage things like Craigslist. We haven't used Craigslist, I don't know how long, but people still use it. And, we offered up $10 gift cards to interview people. And we had amazing insights from these conversations with people who had plenty to say. We ended up having to cut some calls short. But then we also, worked our network and brought in people who had a lot of experience with data sets. So we started to look at open data sets around the census data. We looked at information about, where are PCPs. So we ended up coming up with this really cool map, Eric, where we looked at all the zip codes, like in Houston, for example, and we had the Latino population density marked, shaded a darker color. And then we plotted all of the primary care practices in Houston. And what we found was not surprising, but it was really interesting that the Latino zip codes were the ones that had the least amount of access to primary care physicians. And so when you start to look at patterns and you say, all right, well, why are people going to the ED for something that they could have gone to a primary care physician for? Well, there's your answer. And for the very few PCPs that did exist, for example, in the neighborhood that I grew up in, the supply and the demand was mismatched. The fact that, we have people who are working, who may not be able to take time off work, yet these provider offices are only open from 9 to 5. Clearly, somebody needs to be telling these providers that they need to extend their hours, open up on weekends. And that's the kind of insight that we were able to gather that I think is really going to inform how we approach our go-to-market strategy. And so those are some of the things that we did, interview people, looked at what resources were available to us in the form of data sets, and then just got really smart about trying to extract knowledge out of that to better inform our approach.
And what, so you've mentioned a few blind spots at this point, low access to primary care providers, some of these clinics are only open during business hours, mistrust from communities. What are some of the other blind spots that you've noticed, and why do you think they've remained blind spots so far? I mean, what percentage of the American population is Hispanic or Latino? At this point, it's like 18.
Yep.
And it's the fastest growing, the fastest growing demographic. It's almost a majority in Texas and California, right? So there should be some sort of like economic incentive for companies to pay more attention to the demographic, but they haven't yet. So I'm just curious what your thoughts are as to like why that's the case.
Yeah, and hang on, Eric, give me one quick second because
I have a
4-year-old who's asking for something.
Got it. Dad duties. Go for it.
All right, sorry about that.
No problem.
Yeah, so blind spots. That was the question?
Yeah.
Yeah. And this is where I think healthcare has taken this approach where, again, one size fits all, like this rinse and repeat, because the economics and everything that really has forced them to kind of take this approach to just being as like turn and burn as possible. And I think what happens is when they recognize that, look, you start to have these populations where like Spanish, for example, becomes a barrier, the easy and obvious thing for them to do is just simply translate content. And when you look at some of this stuff, I mean, you're looking at companies like Kaiser and other payers who really don't, like, they'll invest a ton of money into trying to translate, and then they ask themselves like, well, why aren't we getting the engagement? And it's because just that alone, like trying to translate and trying to meet people with language without taking into account like cultural beliefs and a history of trauma and all these things that again are unique to our community. That's where that's definitely a thing that I think the broader healthcare system has just not really gone that deep. That just simply translating content into Spanish is not nearly enough. I think that the other thing is that there's also this with millennials especially, and I think these younger generations as well, that we've just not. I think that there's this opportunity for us to really bring back the conveniences that are associated with primary care. I think, I don't know, Eric, if you have a primary care physician, but a lot of people our age they don't have a relationship with a primary care physician. And as, for example, millennials get older and we start to deal with chronic conditions, this is where things get really expensive and outcomes get a little worse. And we've got to find a way to make primary care, right? The ability to have a relationship with a physician who can handle things like mental health, anxiety, depression, but not just the chronic needs that you might have, but also the helping you with preventative care, right? Some of these screenings and helping you make some important decisions about how you manage some of these things and some of these risks that we might have. We've got to find ways to make these relationships convenient and important. And I think the way we go about that is through this connectedness, right? And one of the things that's really fundamental with how we want to approach these blind spots, right? The fact that people don't have these relationships, I think it's because there's also a lot of mistrust in this patient-provider relationship. If you're not seeing people who can relate with you, who can talk to you, who can understand, some of the concerns that you might have, it's going to be very difficult for you to establish these relationships. And so this is where, for us, we want to bring like the role of the community health worker, these promotores de salud that exist in our communities, to be sort of that navigator, that person who knows enough about the neighborhood, that knows enough about your community, about those types of things, to really get you to a point where we can start to reestablish trust and help you prioritize this relationship with a primary care physician again.
There's one thing you mentioned that I really want to just touch on real quick, which is I think oftentimes, I work with a lot of entrepreneurs here in the region, or you're pitching investors, and there's a question of like, well, Google can do this or Microsoft can do this, and like, what's to stop Google from building your company? And I think there's something really deep that you just said, which is they just don't dig that deep, right? A lot of these companies, they're not paying attention. They have an existing line of business, and unless they think this is going to be, whatever, another dominant line that's going to go with search, or, Facebook buying Oculus or whatever, like most of these big companies don't have the ability to focus on more than a handful of things at any given time. And so there's a huge opportunity for people to look to those niches and to find those like smaller markets that can grow and to establish a foothold before, an Amazon or a Microsoft or a Google comes in. But yeah, I mean, and then on the primary care provider point, dude, I mean, El Paso, probably has a similar issue as to, what you grew up with in Houston. We, even today, like if I need to see a doctor for like a regular checkup, it's a 1 to 2 hour wait. I have to give up like half my workday to see a doctor just to check out, routine things. And, I'm stuck in a waiting room full of like coughing people. And I don't like to deal with that. So like I used to, when I worked in New York, I used to wait till I was in New York to go to like a One Medical in New York, rather than trying to sit in El Paso and go to like a primary care physician here, because we don't have enough to serve the community.
And it's funny that you mentioned One Medical, because we brought this up with like investors, non-Latinos, or other people in the industry. And it's almost like foreign to them that we could create an experience like One Medical for our community. Somehow they attribute that, like, for whatever reason, like we should only depend on safety net services, and like those modern conveniences like aren't for us. And I think that's where, like, I actually feel like I have a chip on my shoulder, because like I've helped build all these conveniences. Like I can get you a lab test without leaving your house, and with Amazon Care, we could get you connected to a doctor in 60 seconds or less. Like here, like, why aren't we doing this for our community? And why should we expect anything less? Like having to wait, having to show up. I mean, I remember growing up in Houston, I used to go to Mondale Medical Clinic. It's a clinic that hasn't changed since I was, a kid. Like those waiting rooms were built for volume, not for convenience. Like this is vinyl chairs, duct tape. You sat there hoping that you'd see someone in 3 hours, and that hasn't changed.
Yeah.
So what can we do? And while I don't have the capital to start opening up clinics in my old neighborhood, I can bring technology into the equation, and I can help distribute some of the demand to again, physicians and nurse practitioners and promotores that can help people, because it's not an in-person visit every time. And for those that are inclined, who would prefer to have an asynchronous visit for something that could be done in that way with no extra risk, then why not? Like we should, we must do that for the community. And I think that's where we have the biggest opportunity. And I think that once people learn that these conveniences are available to them, I think this is what we'll start to demand from the rest of the healthcare system. And I mean, just to highlight that point, I think the one thing I'll mention is that, I've got, my parents are my dad's 80 and my mom's 70, right? 72. So you would think that they're the type of people who would not engage with these types of conveniences. And while that's partly true, like they've come to recognize that things like Amazon, for example, exist. And while they may not be the ones doing the shopping, they do reach out to their millennial son to help them partake in some of these conveniences. So when they learn that I can deliver prescription medications to their house, that they're not going to have to go stand in line at a Walgreens or CVS, then all of a sudden, like, we're bringing these modern day conveniences to the generation that Amazon wasn't building for, right?
Yeah. So I have just a couple more questions, and then I want to leave a little bit of time for Q&A. So if anyone who's listening has any questions, I'll save like the last 10 minutes for that. So there's a recent stat that came out, I think it was Crunchbase a few weeks ago, had some report that funding for Hispanic and Latino entrepreneurs has actually gone down as a proportionate of all venture capital funding. And this is specifically for like early stage, so pre-seed, seed, and I believe Series A. So I was just curious, what was what was your experience fundraising, and what advice would you have for other entrepreneurs in the early stage who are, thinking of starting a company and looking at it maybe being venture backed, and what the challenges might be in establishing a venture backable company?
Yeah. I feel like we have a certain responsibility. Marissa and I talk about this often, that we are of the very few that have received, this early venture capital for this. And I think that had it been any other period in time, we probably wouldn't have been able to raise. I I can't really, imagine what this would have done like 2-3 years ago. But given the where like the politics, all this conversation around DEI, and the market was certainly frothy. Those are all conditions that I think were well aligned for us. But it wasn't easy. Like, there was definitely a lot of relationship building that goes back years, right? Again, that first startup was in 2014. I had conversations with investors. Some of those same investors were involved in this round of funding, a whole, 7-8 years later. So there's definitely a lot of relationship building that needs to go into this. And so, yeah, I think that it's not easy. I think it's definitely hard. I really hope that entrepreneurs don't get sucked into the allure of that, like every startup gets funded. I think one of my responsibilities, and Erik, this, is that I will share my lessons with anyone who asks, and I will make sure that people, know what worked for me and what didn't, and I'll share that with anybody. But I also think that we also have a responsibility to really be honest with other entrepreneurs. Not every company is backable. Not every company should raise venture capital. And I think that for those of us that are in this space where we have, maybe a little bit of a platform to say, hey, look, this is what worked for us and what didn't. I think we need to really invest time and effort into really helping people see the reality of how hard entrepreneurship really is. And that it is a lonely and very difficult journey for many entrepreneurs. So yeah, I think that it makes me sad that we aren't investing more into Latinos. I hope that we could be successful so that we could prove that investing in Latinos is a good move. It's a smart move. And I think that Marissa, I'll speak for Marissa and myself, that we will always make sure that we spend some time mentoring and providing other entrepreneurs that are going through a similar journey, provide them with a mentorship, and most importantly, honesty to help them navigate their own journey.
Yeah, I mean, I think one thing that you just mentioned that's really insightful is, like, you started raising in August and you were done in, what was it, October?
September. Yeah, in a
September. Month. So the headline would be, the TechCrunch headline would be, Zocalo Health raises a pre-seed round, seed round in a month. But really, they're not going to get into the fact that you spent years networking, years building up those relationships. It wasn't a 1-month process. It was a 7-year, 8-year process, right? And I agree with you. I think sometimes that can be misleading. I know when I first started out, I also worked at a startup and was like employee number 4, and helped build it up. And I thought it was going to be really easy, but it's not. Even if you have sometimes all of the signals, the traction. I have a bunch of friends who have everything that you would expect to need to like raise money, and like for whatever reason you might not be able to. And right. So I think it's super important to share that experience and that understanding that what you see in the headlines is not always the truth, and it can be very expensive for people, right? Like, people get into debt and they quit their jobs and take a huge gamble, and you might not get that funding. So it's worth it to be honest about what those outcomes could be like. Yeah. Just last question here. What do the next 6 months look like for you all? And what are some ways that or what are things that you're looking for, things that maybe people in the audience might be able to help with?
Yeah, no, I think that's a great final question for us. The just to sort of recap, we did raise money back in September. We spent a lot of Q4 doing a lot of research. What we've started to do in 2022 is actually start building. We've got a hypothesis. We feel that we now know where we want to go. So our current plan for the next few months is to actually get to a point where we start to deliver care in the form of a closed pilot, like a closed beta. So our plan is to be able to deliver care virtually to patients in Texas, California, and Washington State this summer. So we definitely have a need for more people to sign up. So if anybody here listening wants to sign up for that, you just go to our website. You can go to zocalohealth.com and you'll scroll down to the very bottom and just submit your info. And when we're ready to start inviting people into our pilot, we'll start to deliver care. And we are taking the startup approach. We're going to learn as much as we can from our early patients and customers, refine sort of the process. But our goal here is to really learn as much as we can, figure out what are some of the needs that the community has in terms of access to urgent care, primary care, et cetera. Because for me, the long-term vision is not to just offer telemedicine services, but to offer a hybrid service, a service that allows us to meet you in person, right? Not everybody's going to have access to the internet. Not everyone's going to have access to a smartphone. So if I can also meet people where they are in the community, whether it's in the clinic or in the home or a community center or the laundromat, et cetera, those are all things that we definitely want to try to achieve over the next few years. So for now, I think it's really just getting to a point where we could deliver care. And our plan is to be able to get there this summer.
Sweet. Yeah, so if anyone's listening, wants to sign up, Zocalo Health. Any questions from anyone in the audience? If you do, you just like punch it into the chat and then I'll read it off for Erik.
I did notice that someone posted something about spiritual roots. I'll just provide a comment on there just to see if anyone else types up a question. But I think this is where, if you look at our website, our goal is to really embrace our beliefs, the cultural beliefs that we have from a healthcare perspective. We don't want to build a brand that's like 100% like your Western medicine, experience. Like we certainly are going to have doctors and nurses and everything involved, but we certainly want to have. We want to make sure that when we provide care, that we're taking into account home remedies, people, like how people perceive health and sickness and like what they expect. So that way we don't, again, lose that trust. And instead we build a healthy relationship that allows us to take into account the way people believe healthcare should be delivered. And so it's kind of like a balance between culture, art, science, to really deliver something that doesn't discount our beliefs and how we want to receive treatment.
Just a quick comment there, and there's a question now, but I think my mom was always pushing teas on me. It's like, oh, you're sick, you got to drink this tea, drink that tea, and I never do it because I'm like, whatever, mom, it's like hokey, whatever. And then I follow all these like biohackers and scientists and stuff, and then eventually, like some biohacker scientist is like, oh, that tea, you can drink this tea and it's going to be really helpful for this thing. And like, damn, I should have listened to my mom earlier.
Right.
So there's a lot of value in that for sure. I mean, if people have been using a tincture or something for hundreds of years, there's probably something to it that, shouldn't be ignored. So there was a question, are there any plans to include clinical research somehow?
That's a good question. Not at the moment. I mean, I think that this is where, once we have, the short answer is not at the moment. I think I have some strong opinions around the fact that a lot of clinical research doesn't include, cohorts that include minorities, predominantly, primarily, people of color. I think that I wish there were more Latinos that were being considered for like cancer research and like clinical trials and things like that. I think that if our community tells us that, they want some of these options and would like to be, would like some education or resources to better connect to that, I think we certainly would be in a position to help people find and how to navigate towards those types of resources. But Diego, if you have any ideas or anything, any suggestions, I'm happy to discuss.
Yeah, do you have a contact that you'd be open to sharing with people if people do have like follow-up questions or want to reach out about the beta?
Yeah, so if you I mean, you could find me on social media. So you could go on Twitter or on LinkedIn. You could also email me, Erik@Zocalo.health. If you have any questions, if you have any suggestions, we are certainly all ears at this point. And we're really interested in trying to talk to folks who I think one thing I failed to mention, Eric, was like, for example, in El Paso, if there are community organizations that play a role in helping people navigate healthcare, those are the kinds of resources that I'd love to connect with. Again, if you think about the fact that, the social side, like a lot of community organizations, a lot of social good services play such a critical role in the care continuum. We want to be a bridge builder to those organizations because we believe that this all should be integrated. And so if there are any organizations out there that, want to connect, that feel that they play a critical role in care delivery, or in the health of a patient, would love to talk to them as well.
Sweet. Okay, so there's 2 more questions, and then now there's 3 more questions. A couple more questions, and then I think we'll wrap up after that. But are you planning to serve other minority communities?
Not at the moment. I think right now we're building for what we know, and again, the Latino community is very diverse, and I think if we could stay focused on the Latino community, I think we could better serve the Latino community. And so for now, that is our focus. So yeah, that's the answer to that one.
And there's just two comments. So many observers, including me, believe that healthcare is strongly trending away from traditional medical organizations via the self-health movement, which we believe will resonate strongly with the Latino community and with young people. We see a transition into nascent self-therapy devices that potentially provide a number of needed therapies. Cool STEM, our neurotherapy platform, is one of those self-therapy systems. So that's from Dr. Jack Honeycutt. Sorry if I mispronounced that. And then Angela says, El Paso is a border city. Collaboration with Mexican healthcare professionals and universities is a great resource that is often underutilized, especially with the abundance of medical tourism.
Yeah, that's a great point. I agree with that. Yeah, and I think that's going to be a very interesting dynamic. We've seen resources being leveraged in Mexico, for example. If Angela, you have any connections or can help us kind of bridge these topics together, I would love to just kind of have a discussion. So feel free to reach out.
Awesome. So I think we can call it here, man. We're at time. I really appreciate you taking the time to have this conversation, man. I've learned a lot always from having conversations from you. Hopefully people in the audience got some cool insights. Next week, we're going to have our other Erik friend, or not next week, next month. Erik Ibarra is going to join us to talk about how he built orders. So you guys worked together at some point, right?
He's my compadre. He baptized my my son, and so we grew up. So he's one. So what I like to say is that we were 2 of the few that got to leave the hood and do good stuff. And so yeah, that's my ride or die right there. So
awesome, dude. Yeah, he's I mean another great role model for like building a company and taking a different path than yours, I think, in a few ways. So we're excited to have him on. That will be in March 22nd, I believe is the date. Nancy can correct me if I'm wrong on that. I already forgot the date, but we hope to see everybody there. It should be a great conversation, and thank you all for taking the time and attending.
Thanks, Eric. Appreciate it, man.
Thanks, Eric. See you.
All right. Take care.